Yeah, hello everyone. Once again, welcome to our MRSOG 3 ADC. So this is the one more topic from the subfertility module, and the previous topic was MRKH, that is the Mayer Rokitansky. So that I have given a lot of introduction in that about the May. That's why now in this station, this which is also from subfertility, I'll straight away start with the case. So here. You're an ST5 working in the fertility clinic. Remember, it's fertility clinic. You're about to see Mrs. Lily Eleanor, 32 years, who want to discuss her fertility options. She is in same-sex relationship. And so they're asking nowadays this typical station, and single parent also is important. Now here you gather information, explain management options, and answer her concern. So here now you are introducing yourself. Hello, I'm starting the station. Hello, I'm Dr. Manjula, one of the doctors in the fertility clinic. May I confirm your name and age, please? Mrs. Lily Lenore, 32 years doctor. How may I address you? You can address me Lily doctor. So now coming to the agenda. Lily, I gather from your notes that you are planning to have a kid, and so you are here to discuss your fertility options. Am I correct? Yes, doctor. So I shall explain to you the options available. And but before that, can I get a few details from you which helps in your management plan? Yes, doctor. So I also gather from your notes. Now you can say, in initial itself, you need not say you are in same-sex relationship. Now you say, after talking to her, that now you say, see, I also gather from your notes that you are in same-sex relationship. Is it first, is it, am I correct? Yes, always confirm. Is it your first relationship? Are you, few questions you should ask. So first thing is it your first relationship? And she will say first or second, she will say. Are you in a civil relationship? How long have you been in with your partner? How long? May I ask you about your partner? Take permission. Can you tell me the age of your partner? Is is she fit and well? Don't say he. Is she fit and well? And can you tell me whether anytime you had any sexually shared infection, like anytime you had fever, pain in the tummy, or discharge? Sometimes they may not be knowing what is sexually shared infection. So just ask. Have you discussed with your partner? Have you discussed about who will be the birthing mother and who will be the egg donor? She will say yes or no. So this is about the briefly information gathering. Now about the complaints. Then gynec history. Can you how about your periods? Are they regular? When was your last period? Always LMP. Are they regular? You are regularity LMP. Any pain during periods? Then how about the cervical screening? That is, are you regular with that? How is it? They are normal. Is it normal? Okay. Now this is about the any. This is gynae. Any pregnancies before? If she has no relationship, suppose she says that this is the first relationship, don't ask. Be careful. If she says yes, then only ask. Pregnancies before. Then if she said this is a second relationship, then you say, have you been pregnant before? If she had previous relationship, ask about, then in that case, similar like in any other station, about the full term, how about the deliveries, the full term or preterm, normal delivery, cesarean section, and weight of the babies, condition of the baby, recovery. So these are the things. Now, medical history. Are you on any long-term medication? As usual in any other case. Allergies? Do you have any allergies? Very important. Blood group. What is your blood group? Have you undergone any surgery in the past? Sometimes they can be some endometriosis, whatever. You better to ask. And any family history of any concern? And do you smoke or take alcohol? And pardon me ask for asking, do you take any drugs? Do you know your height weight ratio? Can you tell me your height weight ratio, which is very important for any subfertility station? What do you do for living? How is your support at home? Like, what kind of support you have for your upcoming child? You know, this is same sex relationship. So, I don't know. We don't know whether she is getting enough support from the family or not. That is why. Do you have any have for your upcoming child any kind of support? What kind of support do you have for your upcoming child? Sometimes it can be financial also. Anytime. So you can. Anytime do you feel down or depressed? Anything make you down or depressed? Would you like to add anything? That's all. This is the targeted in history. Now, coming to the examination, So, if you permit, can I, my nurse will check your blood pressure and pulse rate. And suppose she doesn't have no BMI, we will check the BMI. And also, I would like to check your tummy and down below to check for any infections. So now, coming to the management now, applied clinical knowledge. Would you like to add anything? Already you asked. So then, coming to now the discussion, Lily, we generally advise couple and advise general advice couple that birthing mom and the egg donor should be the yes, and healthier and younger woman. So, whenever one thing I would like to tell you, whenever we examine, suppose you would like to do the internal examination, always in the presence of chaperone. Chaperone is very important, and permission, verbal consent, verbal consent. So now, generally, we generally advise couple that birthing mom and egg donor should be the healthier and younger woman. So coming to the management options, I shall tell you, I'll give you explain to you the management options, and after that you can decide. Once you decide, then whatever you decide, it will be respected. So we'll support it. So now coming to the first one option, I shall explain about each option, and then we have a team of doctors taking care of you. You'll be under care of a team of doctors, and then we will attach you to the fertility specialist clinic, and they will do some initial before any procedure, whatever procedure I'm going to explain to you. Before any procedure, they will be doing some blood test. Then that is blood to check whether any screen, that is called screening test, to see whether you have any infection which is caused by some virus, bugs, and some bacteria also. So they do the screening test, and it will be, if it comes as positive, it will be treated. Then some second thing is we do the hormone test to check whether your hormones are normal, your the ovaries are functioning, ovulating, releasing eggs, and so we do the required hormone test, necessary hormone test. And then third thing is we will arrange a scan for you to see whether your womb and the ovaries are normal. And we want to check that there is no abnormality, there is no defect in the womb. And also we will check for the ovulation with the scan also. Then fourth thing, other thing what we need to do is, we will when we examine you, we will take a swab also, a swab from the vagina, and to check whether any infection is there. And so if it is there, we will treat it. So this is about the blood test and the hormone test. Coming to, we want to know whether how the condition of the tubes, because these are the always draw and show, always draw in explaining. This is the uterus, you say, and these are the tubes. We want to see whether tubes are open or not. If that, because the egg and sperm will fertilize in the tube, so we want to know whether they are open or blocked. So what to know that, we will do it. We'll take an X-ray of the womb, and then to check whether the tubes are open. That is called histosalpingogram. Always say full form. Then, and let me tell you, this is not funded by the NHS, this X-ray. Now, coming to the first option, which I am going to tell you, it is called donor insemination, where we inject donor sperm. We do the first option, where we inject donor sperm directly into the womb of the birthing mother, and then who will carry the baby. This is called intrauterine insemination. It can be done at home using sperm from a friend or a known donor, or it can be done in the fertility center, fertility clinics. Also, it can be done where the sperm is taken from the anonymous donor, or from the sperm bank. And we prefer this method, that is doing in the fertility clinic, is what we prefer, because there are some advantages in that. That is, the sperm is screened for any infection, and also there are any genetic abnormalities, whether there are any genetic disorders, we will check the sperm, but which cannot be done at home. So, and this will ensure that the sperm is free from the sexually shared infection and genetic disorder. So that is the advantage if you do it fertility center. The other thing is, in the fertility clinic, they have the support of the legal system. They are protected by the law. So this is what, compared to home, this if you doing IUI, that is intrauterine insemination, in the fertility clinic is preferred. The success, then she will ask the success rate, or doctor, what can be, how much is the person, is there any, how much is, what is the chance to conceive? Or you can say, if she doesn't toss also, success rate is around 15 in 100 cycles. So we can do up to 12 donor cycles we can do. And then and if you maybe conceive and carry the baby, then if so it will be good. And then if it doesn't happen, if you don't conceive in these 12 cycles, we may have to refer you to the for the higher treatment modality, advanced technique, that is called in vitro fertilization. Now am I clear so far? Now coming to legal aspects. Now because legal aspects, because you are in the licensed clinic. So, and licensed clinic, and you are in the, suppose you are in civil partnership, or you are married. Once a baby is born, the birthing mother will be the legal mother of your child, and the second partner, that's the non-birthing mother, will be the second legal parent. Okay? And so, that is same thing is named on the birth certificate also. And the birth donor details would be mentioned as unknown. That's anonymous. And he has no legal right on your child. Am I clear? So, till 18 year of you, till your baby becomes 18-year-old, he will not know about the details of his father. But after 18 years, if he wants to know his father, then he has every right to do so. Am I clear? So, okay. Now, so suppose coming to the other aspect, if you're not in the civil partnership, in that case, once a child is born, the second partner, that is the non-birthing mother, can apply for adoption through court within 6 months of delivery to gain the legal rights. Is this clear? Okay. Now, before we go for the IUI, this procedure, that's intrauterine insemination, you will be given some medications to stimulate the ovaries to produce more eggs, to produce eggs. The growth of the egg is monitored using by doing an internal scan through the vagina. And then once egg is released, it is the washed donor sperm semen is instilled into the womb using a thin plastic tube. It takes only few minutes, and let me tell you, it is not painful. So, am I clear so far? Okay. Now, so then as per the NHS, as per the NHS, what they say is the same-sex couple, they can try for six times using this artificial insemination by themselves. NHS will not be funding these first 6 cycles, but if there is no pregnancy after 6 cycles, then they will be funding the fertility treatment. And it is your choice whether you want to get the first 6 cycles at home or in the fertility clinic. But I already told you, we prefer for doing IUI at the fertility center. And once again, I'm telling you, if you do at clinic, it is clinically safe, effective method, then you're using approved and tested sperms. So the chance of passing on the infections will not be there, will be minimized. Now, this is about the intrauterine donor insemination. Shall I proceed about the second option? Shall I tell you about the second option? Yes, doctor. So it is the second option is using the donor sperm, but we have we use the advanced technique called test tube baby, that is IVF. So that's called in vitro fertilization. Here, the eggs of the donor will be the egg donor, the donor who is willing to give the eggs, she will be given the injections. She will be given the medication, and to develop the eggs, we do the scan regularly to see the development of the eggs. And once they develop, then we collect the eggs with a small procedure, and the sperms are collected at the same time. And so both our sperm and eggs are made to meet in the lab to form the baby. That is called embryo, and this is transferred into the womb of the birthing woman. Am I clear? Yes. So there can be some risk also with this procedure, because the ovaries sometimes can be overstimulated because of this medication, leading to one condition called ovarian hyperstimulation syndrome that can cause some abdominal discomfort, some problems which can be managed by our specialist. Then there can be more than one baby. You can carry more than one baby. That is multiple pregnancy we call. And sometimes the pregnancy can be not in the womb but in the tube. It can happen. And so this is about the in vitro IVF with donor sperm. Doctor, what could be the success rate in this? Yeah, the success rate is 30 out of 100. The success rate will be 30. That is about 3 out of 10. So now can I proceed with the third option? Which so if the yes doctor, if the above two methods fail, or if you do not agree for any of these above two methods which I told you, you can go for adoption, which is legal in UK, and we can guide you through this process, adoption process. The advantage is because you can avoid the use of this medication, fertility medication. Another thing which I want to tell you is, but for before going for the IVF, there are some criteria which need to be met before for to get your NHS funding for this treatment. So like age, and the smoking. If you're in the habit of smoking, you need to stop the smoking. Alcohol, we have to limit the alcohol, and the BMI, that's a height weight ratio, should be at optimum. So less than 30. So now, am I clear? Do you have any other concern? So Lily, no doctor. So I will give an appointment with my consultant, and this is the information leaflet. Whatever we have discussed, you can go through once again, and document whatever we have discussed. I'll connect you to the support group, and also I'll write back to. If suppose she is referred by a GP, you can say I'll write back to GP. If not, no need to say. Then so appointment, patient information documentation, a patient appointment with the consultant, then PIL, patient information support group, and then so this much you have to say to the patient. Now once you discuss with your partner, then once you decide, come down to us and meet our consultant, and we'll proceed with whatever you say. We will proceed. So thank you for your time, Lily. If you remember the name, you say Lily. Otherwise, just say thank you for your time.